Hello, Careblazer. Welcome back. Today, we are going to be talking about one of the most frustrating symptoms that can happen in dementia for both the person with dementia and the caregiver. We are talking about language difficulties, specifically something called aphasia. Aphasia is a condition that affects a person's ability to communicate. And this can be pretty common in dementia as the dementia impacts the part of the brain that's responsible for language. To break this down on a very basic level, there are, we'll say, two broad categories of aphasia. There is comprehensive aphasia and expressive aphasia. When we think about comprehensive aphasia, we think about comprehending. It's the ability for somebody to comprehend or understand language. So when somebody has difficulty with comprehensive aphasia, also known as receptive aphasia, then they're going to have a hard time understanding what you are saying.
Where do you come from?
They can hear your words, they're just not understanding what you're saying. You might notice this when you ask a simple question. They might not be able to respond appropriately. They might not be able to follow simple instructions. It could be a sign that they are having a hard time comprehending the words that you are saying. Expressive aphasia is where the person has difficulty expressing their words. Sometimes it's referred to as Broca's aphasia because it's primarily in the area of the brain called Broca's area. And one easy way to remember this is that when somebody has problems with expressive aphasia, their ability to express themselves, and also it's called Broca's aphasia, their speech might sound broken. This is where somebody maybe doesn't use the correct words. They have a hard time speaking. It might be very effortful and difficult for them to put together sentences, so much so that you, the caregiver, has a hard time understanding what they're trying to say.
School and English class.
Okay.
And I book and I read it aloud.
It can be to the point where they would pick up a pencil, and instead of calling it a pencil, they might call it a cup or a fork or a notebook. They just can't get the right word out sometimes. Other times, instead of speaking in complete sentences, they're more fragmented sentences. Usually aphasia is caused when there's damage to the left hemisphere of the brain, which houses our language abilities. It's also important to note that somebody could have problems with both types of aphasia, both receptive and expressive. So you can have one or the other, or you can have both. Now, can you imagine knowing what you want to say, knowing what you're trying to communicate, but when you open your mouth, you just cannot say it? That would be that expressive aphasia. Or can you imagine somebody is talking to you and very clearly they're trying to get you to do something, or they're communicating something to you, and you're trying with all your might to understand what they're saying and you can't? That's more of that comprehensive aphasia. Both can be incredibly frustrating for the person with dementia and also for the caregiver. One of the things that we can try doing to help with communication, if one of these types are present, is to work in more nonverbal communication using things through gestures, body cues, facial expressions, sometimes written words or images. That kind of communication can work well for people who have aphasia. But my primary biggest recommendation is going to be to request an evaluation with a speech therapist. Sometimes they're called speech pathologists. It's the same thing, a speech therapist or a speech pathologist getting a full comprehensive evaluation. These types of evaluations are not just to see the level of impairment the person has with their speech and what they're able to do. One of the greatest things that they can do, and I've worked with some amazing speech therapists in the past, is that based on what the struggle is for the person with dementia, they can help develop the best communication methods for the caregiver and the person with dementia. They can talk about what would work best based on the level of impairment, and that's priceless, quite honestly. I also want to point out that people with dementia can, from time to time, have problems with their language or in understanding, and it doesn't necessarily mean they have aphasia. They could be having a bad day, they could be sleep deprived, they might be seeing a visual hallucination, so having a hard time focusing on the information you're speaking to them. They might be having a hard time hearing. It's really important whenever we talk about any symptom that we don't just hang on to one thing and clump it as like, oh, it must be this. That's why a thorough evaluation is always important. But I am curious, do you think your loved one might have aphasia? And if so, would you consider talking to their medical provider about a speech therapy evaluation? I will say from personal experience, a lot of times those types of specialty appointments, often the family member has to initiate and inquire about rather than wait around for that healthcare provider to recommend. Sometimes they're just not thinking about that as a possibility that can be helpful, but it can absolutely help reduce frustration and stress in the household when communication is better. Careblazer, I hope that this video has been helpful to you. And if you'd like to work with us more personally and me more personally on what to do in some of these really difficult situations, how to manage the stress, how to build a better relationship with your loved one and enjoy whatever time you have left with your loved one while making the best decision possible for yourself and your loved one with dementia, check out our Care Collective, where we have weekly support groups, weekly expert Q&As. I get to know you personally. It's a lot of fun. Most importantly, it's super helpful. The link to that program is in the description below. I'm sending you so much love, and I will be back next week with a new video. If you have a topic for a video you want me to do in the future, you can leave that below in the comments as well. Believe it or not, we do read them. Okay, bye. Also, Nico gets a belly rub for every person who subscribes from this video. So if you haven't already, click the red subscribe button. It's totally free, and Nico says thank you very much.